Thanks very much. I'm not the chair of this session, but I thought it would be a good idea to actually introduce the chair and a little bit about the session, because as we look to going from action to impact, what we as organizers thought is that we've been focusing a lot on the role of the public sector and their programs, international donors, but there really are homegrown donors that are really going to have much more say in what those ultimate outcomes are going to be, much more active if SDGs are going to be met. So we thought we should have a session on looking at the Indian-sourced donor community, if you like, the philanthropist community, and what they're doing on ensuring that we're evaluating what impacts are being achieved. We asked Ruth Shapiro, and Ruth said, look, I'm the only one who's a chair who's not on your management team, so you better introduce me. Ruth is the founder and chief executive of the Center for Asian Philanthropy and Society, which is a research and advocacy organization that is really devoted to maximizing how private resources for doing good can be improved. Ruth comes to this role. We were talking that she's actually a serial social entrepreneur, because before that she was also the founder and chief executive of the Asia Business Council and various other things. So I can't think of anyone better to actually chair this panel than Ruth Shapiro. So Ruth, over to you.
Thank you, Mani. And I just want to say, I have a PhD too, because in this group it seems like somewhat de rigueur among the people speaking so far, although mine's not in economics. In fact, I refuse to take an economics class. But anyway, okay, well, so thank you very much. I am Ruth Shapiro, and I run CAPS, and the reason we have such a long name is so that we can have a short acronym, CAPS. And we are based in Hong Kong, but we work in 18 Asian economies, so 16 countries, plus Hong Kong and Taiwan, including India. And CAPS actually has just received approval from the government to create CAPS, to incorporate as CAPS India. So we are setting up shop, and I'm in the process of hiring a team. But for today, I'm just here to help, and they won't need much help. My fellow panelists really look good. This is a very illustrious panel, and I think that 3IE's done a great job in bringing together these three people, because they really represent best-in-class thinking among private foundations in India. We work with philanthropists throughout Asia, and I can tell you that there's really not that many Asian foundations and Asian philanthropies that do thoughtful evaluation, monitoring and evaluation. And among the more local organizations, certainly the Tata Trusts and the Azim Premji Philanthropic initiatives are the top of the top. So let me take a moment and introduce my fellow panelists, and then we'll get into the substance of the conversation. To my left is Dr. Suneeta Krishnan. Dr. Krishnan is an epidemiologist by training. She is the head of evaluation for the Gates Foundation, head of assessment, country lead monitoring and evaluation and learning for the Bill and Melinda Gates Foundation. And she works across the programs in India for Gates-related investments. To her left is Mukul Sood, who's the head of assessment and impact management at Tata Trusts. Mukul comes from banking and telecom, and I was just telling him that must mean that he brings a high degree of analytical rigor to his work, which is true. He is in charge of assessment across their 2,000 plus projects throughout India, and making, essentially helping to think about lessons learned for each one of those projects and as a whole. And then last but not least, all the way to the left is Arvind Balasubramanian, who is the lead of the impact team at the Azim Premji Philanthropies. And Arvind comes from management consulting and also brings intellectual and analytical rigor to his role. The impact team at Premji Philanthropies works with all the program teams. And when I looked at all of these, a few things occurred to me. First of all, there's clearly no straight path to becoming the head of evaluation at a private foundation, because all four of us, if you include me, have very different backgrounds, and I think that actually is a very good thing, because we all know that part of the secret to the secret successful sauce, that's an alliteration, of good evaluation is bringing in different ideas and thinking and comparative, so that you can really see things that not everyone who's doing exactly the same thing sees. And so by bringing these alternative and views to the table, it really strengthens evaluation. So I think it's really terrific that we all have different backgrounds. Also, in all three cases, there's a separate, discrete entity that looks at project evaluation in each of these three foundations, and that's really important. I would say that's not the norm in a lot of Asian foundations, where it's essentially embedded in the program areas. So we're going to talk about what the ramifications of that are. So I promised them I wouldn't talk that much, and here I've gone on and on. But let me just then now ask each of my fellow panelists to take a few minutes and just describe for you what their organization does, and how it thinks about and carries out monitoring and evaluation. And Suneeta, I'll start with you.
Okay, well, thank you so much. And in the break, we were thanking Manny for hosting this panel, because in fact the three of us have not met each other before, although our organizations do partner with each other. So this is a great opportunity to get to know my fellow evaluation leads, and also, of course, great pleasure to meet you, Ruth. So thank you so much. So the Gates Foundation is interesting in that the India country office has set up and has had for a number of years a measurement, learning, and evaluation team, a distinct centralized team that actually reports to the country director and works closely with the strategy planning and management team. And together with the strategy planning and management team, we support program teams across our portfolio, and that includes health, which is about 70% of the portfolio, agriculture, financial inclusion, gender equality, and my colleague Yamini was on the previous panel sitting in the back. And so the approach really is, we understand evaluation as a systematic assessment of an ongoing or completed set of actions. And the way we approach evaluation is in order to better understand how those actions sort of play out in various different contexts, for who those actions have led to intended outcomes, and how and why. And I think really unpacking all of those aspects of what is actually happening as a result of these interventions, investments, or programs is really important. Linked to that is also attention to unintended consequences. Who might be left out of specific kinds of intervention schemes or programs, and what therefore are the implications for ongoing implementation of programs, or the evolution of policies. One example of that is in some of the evaluations that we've conducted of digital interventions, mobile phone-based interventions, particularly to improve maternal newborn care and health. We've noticed that there is a significant subgroup of women who are left out of these interventions because they lack access to mobile phones, or they do not have the sufficient digital literacy, the skills to actually be able to use the mobile phones in a way that they can actually capitalize on the interventions that are being delivered through that technology. We've also noted that that subgroup of women also tends to be disadvantaged on many other axes of social inequality. So they may be, belonging to poorer households, living in poorer communities. They, may be of a disadvantaged caste, etc. And so these kinds of interventions, by leaving that subgroup of women out, might actually be exacerbating their vulnerability. So that's the kind of insight also that our evaluation seeks to produce. Very quickly, I'll just talk about 4 sort of key features of our evaluation approach. First is a focus on building a culture of evaluative thinking and learning, and this is really crucial because the evaluation team cannot be the sole sort of purveyors of evaluative thinking. We need our entire organization and the entire ecosystem of partners that we work with to actually share in our evaluative approach, in thinking critically about what is being done, and to actually foster and promote learning. Secondly, our approach really aims to shift the focus away from specific projects and specific investments to looking at systems, looking at combinations of investments or portfolios, and programs as a whole. So we really are interested in understanding how an ecology of interventions actually helps to produce the kinds of health and development impacts we're seeking. And this means that in the evaluations, we pay specific attention to underlying mechanisms and system dependencies that influence the impact of development actions. Third sort of approach or element of our approach is a focus on understanding the complexity of interventions. In the context of health, for example, we, a lot of our investments are focused on strengthening health systems, and we believe that health systems are actually complex adaptive systems. And so the interventions themselves tend to be complex, and we need to use a plethora of disciplinary approaches and methods. I think the previous panel talked about the importance of multidisciplinarity. So that's a very key feature of our evaluation approach. And finally, our approach brings a focus on equity and the issue of leaving no one behind. And we believe that the role of evaluation is to question whether our strategy and our investments actually operationalize that commitment to leaving no one behind and to realizing the Foundation's mission, which is that all lives have equal value.
Okay. Thank you very much. And Mukul.
So I represent the Tata Trusts, which is separate from the Tata Group. The trusts have been in philanthropic activities for over 120 years. We've been doing philanthropic activities, and most of the institutions in independent India have been built by the Tata Group via the Tata Trusts. So be it in education, be it in science, be it in arts, you will see massive institutions which have withstood the nation's service for many, many years. So the trusts as such have been present today in about 15 different verticals. And in these 15 verticals, we have approximately 2,000 program IDs. Each program would constitute approximately between 20 to 30 indicators. So now when you multiply the numbers, you can see the complexity of the operations where money is being channeled. The work that I'm trying to set up or trying to build on is to digitize the information that we gather from the field. We were primarily a grant-making organization, but for the last 2 to 3 years, we are now implementing our programs directly. When we implement these programs directly, we need information, primary information from the beneficiaries that we are touching in order to guide our decision making that much better. So that is the role that I'm trying to put in place right now. Like I said, we have over 2,000 program IDs, maybe about 1,000 programs would have measurable indicators. Two aspects that Suneeta touched upon earlier, I think, and in the previous discussion also. Two aspects which are very key to the programs that we work on are scale and working with the government of India. These are two aspects that most programs and most themes focus on. Apart from that, there are also a multitude of programs. So the point I was trying to bring out is the diversity of our portfolio. We work in the Northeast. We are trying to uncover champions, Olympic champions. We work with mentally challenged people. We work in education, health, nutrition. There are 15 different vectors that we work in, and trying to build an aggregation of data that is available for interpretation and decision making across these multitudinal disciplines is very difficult or very challenging. So that's roughly where my role is.
And I just want to make a point that Mukul is absolutely right that the breadth and the depth of the Tata Trust is so extraordinary. And I didn't realize how much this was true until one day I was going for a meeting and I passed by an office and there were hundreds of people in line. And I found out that that office was where the trust was still and will continue to give direct money to people who have a financial hardship due to a medical emergency. And they just can't, they have no other alternative but to seek this help, and the trust has been for 100 years giving that kind of assistance. So it's everything from wide scale, really systematic change in scale that scales to helping, you know, an individual whose son needs an operation. So the extraordinary breadth of what Sukul works on is, I think, somewhat unparalleled, and so it's great that we're hearing from him. Arvind.
Hello, so thanks, Ruth. So, as I was hearing Mukul speak,
Bring it closer.
yeah. Am I audible now? Yeah. Yeah. So, I anchor the impact function at the Azim Premji Philanthropic initiatives. And we are fairly young, about 5th year of operations as a grant-making organizations. And in a lot of our conversations, we look up to the work that either Tata Trusts or BMGF does in a lot of conversations, and we have a lot of connections when we come to it, when we come to specific decisions. In fact, we are still discovering what is the right way to call our team. Impact seems a bit too definitive and too strong, so maybe implications, we don't know. Right?
Implications team.
Yeah. So essentially, in a grant-making organization, our team or our function, because our team may be small, but the function is spread across the organization, or should be spread across the organization. Essentially, we are answering one question: how to become a better grant maker, and that question has different implications at the leadership and board level, where the question is on what is the summary of the effect of all the support we have given, how do we make sense of what is happening, will we see some change? Those kind of questions are what grapples them, and we are trying to synthesize something to go through that. On the other hand, we have taken a conscious decision that till last year this was a CEO function, in the sense the we would report to the CEO, but now we've taken a conscious decision to move and report to the programs, because we clearly see that if we don't integrate well within the programs team, and we bring this idea of what are the effects, what is happening, how do we understand better how the context is changing, then we end up being a silo function who comes from time to time and engages. One other thing which I noticed was that the way we are in our journey right now, we have a large number of grantee partners who work in multiple thematic areas, similar to the kind of thing that Mukul was talking about, but at a much lower scale, so about 120 odd partners. On the other hand, we have a few long-term investments programs, like the work that we're trying to do in Odisha on malnutrition. Again, that's another place where we closely work with BMGF to understand from their experience in UP in the health space. So these two have very different flavors in terms of the work that is expected from us as the impact and learning team, and that's the other thing. One is it is very difficult when you're talking about 100 odd, 150, and which will soon be, let's say, 200, 300, to look at it at a grant level and make any sense out of it. So then, how do we synthesize it? How do we look at it as portfolios? How do we look at adjacencies between portfolios? Those are the kind of things that we deal with. Whereas in the case of large programs, it is about building evidence. It is about answering whether it works or not, and then scaling it up, replicating. Those are the kind of objectives. So that's the two interesting problems that grapples me and my team.
So I was thinking about this session vis-a-vis the other sessions, and in many of the other sessions, it's an external evaluation team coming to look at an issue or a project, and they're come from an organization like 3IE or a university. In the case of foundations, one of the critical aspects is really learning from what you're doing and incorporating that learning such that you evolve your strategy going forward. So you need to create feedback loops so that you're not only evaluating that project, but improving your own strategy in order to do, as Arvind just said, to become a better grant maker. So we've asked each of our panelists to provide an example of how a learning or an insight from an evaluation effort caused the organization to pivot their strategy in some way. So let me reverse the order and start with you, Arvind.
So the question is, where did we pivot by understanding? So one of the programs where we are working, we realized that, and again, in most of our cases, we've been in the early stages of the program. But right in the early stages of the program, when we came up with a baseline report and trying to work with the government and our teams, it is so frustrating, right? It's as if what we are dealing with, heads I win, tails you lose. In a sense, as long as it confirms the hypothesis that the program and the government team had, the things are going on track, otherwise it doesn't. Otherwise they'll say that they'll find some small issue with it. This is, how can you ask this question? This is not, this does not tally with some other data and so on. And we did pivot on the basis of that. We clearly realized the need to build capacity in our entire program team. So right now, at least it has brought us to a stage where everybody in the program teams understands what type of evaluation can be used, where one of the terms that we borrowed from 3IE is the evidence gap. So we do that more systematically, and everybody understands that, because otherwise one of the struggles that we constantly have is we churn out these studies, evaluations, and so on, and it hardly has any effect in refining the program. And it's not like we are also extremely confident of that we can say that this should be changed this way. But to be able to work together with the programs team is a struggle. So that's a big pivot in our strategy. So one of the reasons to move it to face the program team as the end customer was to ensure that over a period of time everybody understands the importance and also are able to converse in a common vocabulary when it comes to impact evaluations and so on.
Yeah, I think that's really important. So rather than evaluation being essentially a parallel effort, this becomes much more integrated into the program area as a result of your learning there.
We are a long way from it.
Okay. Hope springs eternal. Okay, Mukul?
So I'll talk about one of our programs from the nutrition portfolio. In this nutrition program, we were working in Navi Mumbai, which is, the new Mumbai part. And the program there was trying to add vitamins and iron to grain, wheat grain. So food fortification was the program. And the intention was to add vitamins and iron to wheat. And this was done as a pilot because the government was not very confident about how it would be perceived by the people. So these vitamins and iron was added to wheat grain and it was distributed, and it was not very successful. Then we, basis field research, basis interventions, basis discussions, we said fine, let's grind the wheat into flour and then add the vitamins to it and then distribute it through the public distribution system. There again, it did not do too well, and again this impact or this input was given from the field, because the flour that was used to make roti, the bread that the Indians eat, was cooked in the morning, and by the time the person ate it in the mid-afternoon or towards the evening, the flour would turn slightly dark because of the addition of these additives. So that was a big, sort of realistic feedback. And then earlier we were giving the grain and the flour for free, but then when we started adding back the cost of milling the grain to the program distribution, again the cost rose and people were not that supportive. So when we shared this information back from the field with the government, it was decided that, look, it's not worth it. You're going to attempt to try and change eating habits. You're going to, at a higher cost, at a higher price. Perhaps this is not the right time. Using those learnings, we took it to another part of India, the district of Gadchiroli in Maharashtra. Gadchiroli is Naxal dominated. Naxal, for your common understanding, is Marxist dominated areas where the writ of the government may not run as strongly as one would like it to. So a parallel government based very heavily on violence dominates. So in this district it is extremely sensitive, politically sensitive, socially very sensitive area, and if you're trying to do anything there, the government is particularly closely monitors what you're doing. So in this area we said we will try to fortify food fortification in rice. So using the earlier inputs and the earlier learnings, this time we created pellets or kernels of rice of this vitamins which resembled rice, and that was mixed in some quantity to the rice grain, and then that was distributed. Much more successful, much better feedback, much better offtake, much better acceptance. And this was shared with the government, and now that program is adopted across multiple districts in Maharashtra. So two aspects coming straight from the field: first-hand information, first-hand measurement, first-hand assessments.
So Mukul, just out of curiosity, in the first case, you ended up charging a little bit because you had to mill the flour.
Yes.
To make those little pellets, did you end up charging for the fortified rice?
I think not. I think because basis that, I'm not sure, but I think not. They would have understood that, look, even might as well absorb the cost as part of the grant process and then do that.
And is it your observation that most people knew that they were getting fortified rice?
So we did a lot of canvassing, if you will. We spoke to the shops from where this was being sold or being distributed by the government. There were lots of posters put up around the district explaining what the trusts were doing, because these kind of things can spin out of control so fast, and you can be labeled as somebody who's doing something really heinous out there and trying to mess with people's health and traditional beliefs. So it's very important to manage your environment, to manage perception of what you're doing. So I think the program team executed that very well on the ground there.
Well, that's a great example. Okay, Suneeta, you're up.
Okay, thank you. So the example I thought I would share has to actually do with how the foundation and our health program team has revised and refined our theory of change. And I wouldn't necessarily stake a claim for this in terms of that evaluation is responsible for this shift. I would say it's evaluative thinking. I think the role of the evaluation team has been to help identify patterns, insights that are consistent across a number of different evaluations, as well as summaries of program experiences, and helping to then find appropriate conceptual frameworks that can help address some of these patterns. Let me get to it seems very abstract and theoretical. So what we found, backing up, the foundation works extensively in the states of Uttar Pradesh and Bihar, and there we work primarily with the government, but also with other development partners to essentially strengthen the health system to deliver RMNCH and infectious disease-related services. So this involves supporting the government to improve supply chain, taking sort of the 6 pillars, the WHO defined 6 pillars of the health system, working on information systems, helping to actually improve service delivery, for example, through mentoring and training of nurses who work in labor rooms, mentoring and training frontline health workers, ASHAs, to provide health-related information and to make linkages to healthcare services. What we have found consistently across multiple levels of the healthcare system, both at sort of the managerial administrative level, as well as the facility level and at the community level, is a very significant no-do gap. So what we find is a lot of these interventions that are focused on improving systems, equipping individuals who deploy these systems or who use job aids and actually deliver services. When we equip them with knowledge and skills, we find, the evaluations find and the program data indicate that their knowledge and skills actually improve, and that while the support is in place, practices do improve to some extent. But what we find is that when we look at it over time and when the actual training support is withdrawn, the knowledge might actually have stuck, the skills might still be there, but we don't actually see the doing, we don't see the practice. And I think everyone here is probably very, very familiar with this no-do gap. So as we synthesize the information that we were getting from program sort of monitoring as well as from external evaluations, we looked at the global literature and understanding of how healthcare systems operate. We realized that, well, what seems to be potentially going on here is that we're improving what we would call the system's hardware. We're improving, helping to improve physical infrastructure, we're improving information systems, we're improving training and mentoring and supportive supervision systems, but we're not really addressing the system's software, which is the ideas, the values, the norms, the power dynamics that actually influence the extent to which all of these resources and systems actually get operationalized into actions by individuals. And I think this insight was a pivotal insight, because we realized that the investments in building systems, hardware, were really critical, but they were contingent on changes in the system software. And so we've realized that we actually really need to focus on, the human resources for health, how individuals are recruited, how they're trained, how their performance is managed. So we really need to pay attention to performance management systems, for example. We really need to pay attention to incentives. We really need to pay attention to gender dynamics, because we see within the system that the individuals who have power tend to be male. The individuals who are actually getting work done at the grassroots level, but who have the least amount of say in what they do and how they do it, are women, right? So these are some of the issues that we've sort of highlighted for our program teams to consider, and this has led to restructuring really of our health investments and our health portfolio.
That was a great example. Thank you very much. So one of the key aspects of working in India is that you're working with and alongside government essentially from the beginning of your program. And there's other places in the world where foundations need not think about government. That is certainly not the case here. All three of your foundations work hand in hand with government, and as Arvind said, it's not that easy. But the evaluation team has very good learnings about what's working and what's not working, and you have insight not only in terms of the project intervention, but also policies. So I wonder if, I originally wasn't going to ask you, Suneeta, but you should answer this too. How do you communicate what your findings are to the government? What has been, what's their appetite to learn from you? How has that gone? How much of your time do you spend trying to do that? Or do you delegate it to other members of your team? What is that mechanism for you to essentially share your learning with your government counterparts? And who wants to go first? I don't.
I can answer that.
Okay.
We actually have a dedicated vertical. It's called Data-Driven Governance, which is based out of Delhi. And the purpose of this vertical is to influence government policy. And they do a lot of this lobbying, influencing, trying to impact government policy basis the data that is collected through our programs. Like I said, we work with over 600 partners, NGO partners. We have maybe 2,500 employees. We have maybe 1,000 programs which have measurable indicators. So there's a vast amount of primary data that is being generated, and it's available to show policymakers in New Delhi as to what works and what doesn't. In terms of actual hard numbers, we count audited beneficiaries in the last 2 years exceed 47 million beneficiaries, people whose lives Tata Trusts has impacted. Apart from this, there are advocacy-related beneficiaries, people whose lives we may have impacted through legislative changes, through changes in laws. So these are, beneficiaries whom we don't measure and which could possibly run into many, many more types of, many, many more millions. So those numbers perhaps do weigh with the government, and to some extent we are able to change policy, to move the needle a little bit.
Do you know of an example when you've been able to do that? It's putting you on the spot. You don't have.
Well, virtually most programmatic themes I would suggest have impacted, but I'll talk about one of our biggest programs. It's called Internet Sathi. Sathi in Hindi means companion. So the program basically works in consonance with Google, and the intention is to train young girls who are up to standard 8 or studied up to some basic schooling. So these young ladies are trained or given training on how to use the mobile phone and benefit their communities. So using the mobile phone, they can enable basic banking, book a train ticket, look up some information relating to weather. So Internet Saathi has been an enormous success. Approximately, I'm guessing maybe around 3.5-4 million such young girls have been trained on mobile technologies, and this feedback, this kind of stuff, this kind of information has flown back towards policymakers, trying to show them that this is a trained workforce which can gather information when elections come around, when disasters happen. You can disseminate a lot of information, and a lot of movement, a lot of momentum can be generated using these young kids out there. So laws, it may not be that one single law has been framed, but what I'm trying to suggest is that a multitude of legislative changes are impacted by this kind of data being available.
That's a great example. So the government is essentially mobilizing these young women in ways that they didn't before, based on that input and those changes. Great. Arvind.
So last month we spent a couple of days with the program, one of the larger programs again with the state government, where it took us 2 days primarily because we tried to list down every source of information, all the source of portfolio of information, evidence that they gather, and including systematic studies, but also things like what they call as a debrief meeting, what is a joint review meeting, all those kind of things as well. From there, integrating it with the kind of information they get from the MIS and so on, the management information system that they have created and so on. And then that allowed us to also work together to establish a hierarchy of reliability of data, to say where we are, how can we combine different sources of data to triangulate certain understanding as things go on and so on. And it also allowed us to have a full-fledged conversation on how decisions are being made, because decisions are not being made purely on the basis of an evaluation report, and not just evaluation report, a project report or things like that. There are a lot of other factors that come into play, and we could have that conversation. So, and this is clearly the job that I need to do. But it was also attended by, from our side, it was, all the senior people, including the CEO, everybody was there, because this was something which was important, because we were going into a stage where we're talking about really scaling up the program and so on. So I think that's one area, one experience in the recent past which was very useful. And what we have come up after that is now identify these are the gaps that we need to work on in terms of gathering evidence, building understanding, and we learned a lot in those 2 days. So that's the closest I can think of where we are progressing towards having a more. One more thing that came out of it was that we needed to invest in the technical capacity of the government team. So we are now in the process of investing in that capacity as well, so that we have a counterpart who can focus on this. Otherwise, it's usually in this case, it was held by somebody who was also looking at the financial aspects of the program. So how much time will that person be able to give? So we recognize the need for a dedicated resource. So the conversation was in that sense quite constructive.
Suneeta, before I go to you, I just want to point out and actually say, so building capacity of grantees is something that many foundations and organizations think about, and I'd like you to speak to it. Building the capacity of the government counterparts, is something that actually all three of you do. And I don't know in your case if that happens throughout kind of the gates, global gates, but it is something that happens in Asia quite a bit, where you've got essentially private resources educating government. And so I think that's a really good example, and I'd love to hear others, because it's not something that happens, I think, very often in a Western context, but it certainly happens here in India. But you can answer the first question, like how do you work with government more broadly?
So I'll restrict myself to how the evaluation team works with government, because our program teams work with government, and they are, constantly deploying evidence also in terms of making, policy or program relevant recommendations to government. But in terms of how we approach government as an evaluation team, I think there are two components to our engagement with government. One is, sort of fostering the pull for evaluation and for evaluation produced evidence. And the way we sort of are fostering the pull on the part of government and government counterparts for evaluation evidence is really building trust and relationships, bringing credible partners to the table, who and really listening to what are the evidence needs of our government counterparts. Where is evidence actually going to really make a difference in terms of the decisions that they want to make? Because many a time decisions are driven by political considerations, by resource constraints. So there are numerous different factors that policymakers, decision makers in government actually need to take into account. And so we recognize that, and we want to, as far as possible, really go where we think the evaluation, the evidence can provide the most value. And so it's partly through fostering that pull, trust in evidence and evaluation, and then really paying close attention to what are the specific kinds of decision-making related challenges that government is facing. One area where I think there's a good match between sort of the pull and what government counterparts want and what evaluation organizations want to push towards government is in better understanding program or scheme implementation. I think we recognize in India that we have pretty sound policies for many things. We have pretty well sort of framed programs and schemes, but a lot of times we fall, it's a slip between the cup and the lip. We don't actually realize the potential of these programs and schemes because we don't pay sufficient attention to program implementation. So a number of our evaluations are centered around that issue of program implementation. On the push side, one of the things that we're doing is developing platforms for researchers to engage with not only government, but particularly with advocacy groups who are advocating for certain kinds of change, certain kinds of policies, or changes in program implementation, and helping researchers really understand, again, what kinds of questions, what are the most important questions that need to be posed from the point of view of an advocacy organization that has a very clear vision of what kind of change is needed. Because often researchers, come up with questions that are interesting to them, that they see perhaps based on an evidence gap map, etc. But those questions may not necessarily be the most important questions, top of mind for program decision makers or advocacy groups. So these are some of the ways in which we approach this issue of engaging with government. And then there was a second part to your question.
The second part was building the capacity of government to do their jobs and also to hear the evidence. It's not automatic that every policymaker is going to necessarily appreciate what it is that so do you help build their capacity to receive this information? And I would ask that of the others as well, but first you.
Sure. So our policy and policy advocacy team has collaborations with various training institutes that, for example, help prepare the Indian bureaucrats. So Labasna in Mussoorie is an institute where the foundation helps to bring both India-generated evidence as well as local experts to go in and engage engage with bureaucrats and to help build their understanding of health and nutrition, for example, and as well as what is the role and value of evaluation. So we have partners who go in to do that kind of orientation. I think an area that we as evaluators and researchers probably need to do better on is what I call knowledge mobilization, which is really producing, developing knowledge products that are accessible and usable by government counterparts, by policymakers and decision makers. So I think often it isn't a question of there not being enough capacity. I think the Indian government, I've been absolutely astounded by the amount of capacity and sophistication that it resides in the Indian government, in our partner landscape, etc. But often I think it is this mismatch between what researchers and evaluators are, how they are used to communicating and how these different stakeholders, need what they need from us in terms of usable products.
That really resonates with me. I know 2 weeks ago I was in Myanmar and we were asked to do some work for an organization there, a company. And he said, well, we hired an evaluation firm to do this before, and they gave us a 90-page report. And I said, well, what did it say? He said, I have no idea. It was 90 pages. So I really want to hire you, but it has to be shorter than that. Use bullet points. But if you could just speak to, has the government, in your experiences, been, what's the appetite to receive this information, and is it case by case, or what's your experience with that?
So we haven't had any standalone kind of approach towards capacity, because we are learning, they are learning, everybody's learning. Okay. But definitely in specific programs, we've tried to, in some cases, try to anchor that role, because it gets neglected, of commissioning the study, of managing the program and so on. But in most cases we've had the government's, and government again is one big term, right? The people whom we are working with, they definitely are part of the initial conversations when we are scoping it. I don't remember any situation where we were not sufficiently assisted in through the data collection, analysis, and so on. What happens in any meeting happens over there, which with the government in the room as well, which is that this 90-page phenomena, right? So nobody's read the 90-page report, and the point is, many of my team members have read it. I may also not have. I may have only read the first 40 pages, but. And in our earlier conversations also, that's what I was saying, that that's something which we need to look at how we can do a better job at that as the professional group.
Well, we work at two levels. One is at a program level, where the program is being executed. We work with the local government and the local bureaucrats. But more importantly, I think we work very closely with the Niti Aayog, the central planning powerhouse of the government. So with the Niti Aayog, the Tata Trusts are often called upon to run pilots or give data firsthand. And that is, a large part of how we work with the government at a central level. But at an execution level, at a program level, then they work with the local setup. Right. So at both levels, the trusts are involved. A large part of our resources or our experience goes to frame large pilots that the government wants to run. A recent example would be the water mission that the Prime Minister has announced in India. So the trusts have been called upon to help frame the framework of how the water mission for India should roll out, what it should look like and what should be measured. So it works at multiple levels. Okay,
I'm going to ask one more question and then I'm going to open it up to the audience. So I'm hoping that everyone is thinking of a really good question for our panelists. So we were CAPS just did a study on what are learning organizations and what are learning communities. And we looked at organizations that are considered foundations in the United States that are very much considered learning organizations. And we actually have someone in this room from Hewlett Foundation, or formerly from Hewlett Foundation, which is considered essentially best in class when it comes to being a learning organization. And one of the things that differentiates Hewlett is that she might correct my language, but they celebrate failure in that they really want people to share when they failed, not when they have failed, but what policies, what projects, what has not worked. And Hewlett Foundation goes so far as to have an entire week, Failure Week, which I hope is accompanied by large amounts of alcohol, but I didn't ask that question. So I just wonder if you can speak to, within the culture of your three foundations, how is failure viewed, not failure, personal failure, but project failure, and how is it cultivated, and do you have a role in bringing about that culture? Arvind, you look like you have an answer to this, so.
No, I was thinking about my own failures. So, but this is, the term learning organization fascinates me a lot, but it's very difficult to understand how, learning is such a complex process at an organization level, whether we are, to simplify it in my mind, it's just that how fast are the feedback loops, how strong are the feedback loops, and what happens when you get the feedback, are you acting upon it? And that's something which we've tried whatever we can in order to shorten those loops and so on. So one of the approaches, again, we tried to popularize it by giving it a jargon kind of sounding name, which is that can be designed for impact, in the sense that how can we be part of the thing which allows for failure, which allows for experimentation and so on, but we haven't actually had enough experience for me to share something which is concrete. We've also been talking about why shouldn't we celebrate failure and so on, but I don't know whether we are yet ready to have that honest conversation, right? So I remember in one of the interviews that one person came, and a standard interview question is, what are your weaknesses? That person responded saying, I'm a workaholic. That's not the kind of, so to have honest conversations on failure and learn from that, I think it's to be more systematic about gathering evidence, and I don't think there is a question of success and failure in the kind of social change that we are talking about. It's only consequences of actions. So one thing which I resonated quite a lot with what Suneeta was saying was, we are now definitely focusing more on implementation, process evaluations, and so on, because we realize that impact evaluations is a much longer term game. So so those are the kind of things that how we are changing, but nothing specific.
Well, I'd like to take a slightly different spin on this. The recent attempts are to move to an organization that is actively monitoring its programs. And when I say monitoring, it's on a real-time, data-driven basis, as opposed to a point-in-time assessment when you do an audit of the program at a particular time or a particular point. So till very recently, we used to do a lot of audits which were valid at a particular point in time. Now we are trying to move to a always-on monitoring role. In the earlier environment, many programs were stopped or funding was denied basis the findings that the audit team came up with. Failure is found out and is dealt with. My challenge is that now that one is trying to move from an assessment environment trying to move to a monitoring environment, how fast can we react? Will we react in in real time, or will it again sort of have a lag? So that's something that I can't answer now because the monitoring environment is not yet fully up.
Well, one of the things you're really doing, and it's actually another question which I didn't, is using technology to do much more real-time assessment, which is something, of course, that's new. So do you want to just mention what you're doing with that?
So what we've started doing is that all our programs are required to report programmatic data, indicator data, for the period which is relevant to that indicator. So somebody might have seasonal data around agriculture. Somebody may have end-line data relating to a 4-year, 5-year horizon. Somebody may have quarterly data that is to be reported for that indicator. So now the requirement is that if you have set up an indicator that has a quarterly reporting, then make sure that your data is in place on that quarter. If it is a semi-annual, then it has to be semi-annually, and so on and so forth. Basis this, and it's all digital. We've given our partners and our employees, we've given them mobile handsets. There's a mobile app through which primary data is collected. Field interviews are done. Those field interviews, the data from those interviews feeds back into the central digital platform, and then real-time data is available to decision-making. The point that I'm trying to bring about is that as we move into this monitoring environment enabled, how fast can we move to a decision-making mode? Will we still depend upon voluminous reports coming in from the field with photographs as evidence? So I've held an eye checkup where 500 people came in, and here are my photographs. Now those kind of things are increasingly being discouraged, at least by my team. I'm saying if you've had an eye cam for 500 people, please show me the register in which you have recorded this attendance. Right? So we are asking for hard digital information which can be recorded, validated, audited before we accept that this program has indeed executed its ask. So those are some of the things that we're doing.
That's great, because that allows for real-time course correction when you need to. Suneeta.
Great. So the first question around, do we celebrate failure? Do we share and failures? I think our program teams, very much, reflect on what's working, what's not working in a very real-time way. I think, in fact, this has been more of a challenge, I think, to us as the evaluation team, which is, to really, when we identify that certain kinds of, certain hypotheses may not be actually panning out, certain mechanisms or assumptions that were being made aren't, holding up. How do we actually surface that in a way that fosters a constructive, forward-looking, forward-moving kind of conversation? I think that's especially difficult when it's an evaluation team that's bringing those kinds of difficult insights to the table. I think our program teams are very comfortable sort of being vulnerable with and amongst themselves. I think when we're in the room, it becomes a little bit more fraught. And challenging, and I think that's where really building strong relationships built on trust, being an evaluation team that is embedded within the program context, within the program space, that I think all of those things become really important to foster that culture where you can celebrate failure. And I think the India Country Office, we're on a journey. I think this is something we aspire to. I don't think we do it well. But it's definitely something that we're very aware of. In terms of the use of technology, I guess because many of the program areas that we work in, or issues that we're trying to help solve for are complex, I think the role of technology, we have to look at technology as one way in which insights, information can be collected, gathered, and used, but not like I don't think we can reify technology. You know, I think there are limits to how much and what kinds of information technology can gather. And I think that's where being an embedded evaluation team, bringing multidisciplinarity, bringing, plurality of methods, a plurality of ways of knowing, and also ways of knowing from different points of view. Because the program looks very different from the point of view of an external evaluator versus a program, monitoring sort of role versus, a woman in the community versus the provider who's actually trying to deliver the services, etc. And I think it's really important to bring all of those different perspectives together before you actually make judgments around what's working, what's a failure, etc.